So let's talk about today about hormone replacement therapy in the post-menopause, a topic that I get asked about really frequently and a topic that has been really stigmatized for a very long time. So what is hormone replacement therapy and what is its purpose for menopause? So hormone replacement therapy is for women with uterus with estrogen and progestin in order to protect uterine lining from developing abnormalities. And if you do not have uterus because you got operated, we offer you estrogen only therapy. And then hormone replacement therapy is actually a very safe option. If you are healthy and if you have symptoms and if you are within 10 years of your last menstrual period and you younger than 60. What are the other things to consider? You shall not have any contraindications for this type of therapy. So what are those? And this has to be stated very clearly because lots of patients get confused about correlations that do not apply to them and to their personal situation. So the contraindications to your hormone replacement therapy include history of breast cancer, coronary heart disease, previous thromboembolic event or stroke, or active liver disease. So again, it's important to remember that estrogen and progestin are being used in women with uterus, and estrogen only therapy we use in women who do not have a uterus. For women with vaginal atrophy and pain during sex related to low estrogen, we use low dose vaginal estrogen, which is very effective. Once again, hormone replacement therapy is actually the most effective treatment of menopausal hot flashes, vaginal atrophy. Those symptoms are caused by low estrogen levels, but other symptoms such as sleep problems, mood problems, depression, or even in some cases joint pains, aches, muscle pains, they also improve with hormone replacement therapy. So what are the news? I want to provide you a short summary of the recent FDA changes. And here's the thing, the FDA has actually removed the long-standing black box warning from most systemic menopausal hormone therapies. So what kind of conclusion should we draw from that? This decision actually reflects a renewed analysis of the evidence showing that the woman under 60, or as I've mentioned, within 10 years of your last menstrual period, for those women, the benefits of hormone replacement therapy generally outweigh the risk. The box warning regarding unopposed estrogen in women with a new intact uterus remain in place, which really makes sense. Because if you have a uterus, your hormone replacement therapy should most definitely be of estrogen and progestin in order to protect the uterine lining from developing abnormalities. And as always, individualized risk assessment is essential, especially if you are worried about your cardiovascular and oncological risk factors. Overall, I must say the new labeling allows us for more precise evidence-based counseling of our patients, moving away from the blanket cautions toward a nuanced, patient-centered evaluation of risk and benefits, which is a really step forward. So let's discuss the benefits of hormone replacement therapy for menopause symptoms. Those are benefits number one, against hot flashes and night sweats. As I've mentioned, and I will stress it again, hormone replacement therapy is the most effective treatment for moderate to severe symptoms such as hot flashes and night sweats. And here's the thing, you can achieve actually a symptom reduction up to 70 to 90%, which is really far superior to any non-hormonal options such as supplements that are available on the market. And here's the thing that might interest you most. The improvement is quite rapid. The improvement in your sleep, in your condition, and also in your daytime functioning. Number two, as I've mentioned, joint and muscle pains. Many women report reduction in joint pains with estrogen therapy. Actually, the Women Health Initiative study demonstrated significant improvements in musculoskeletal pain scores. And why is that? We now know that probably estrogen modulates the nociception, and inflammatory pathways in your joints and muscles. Isn't that interesting? Number 3, the genitourinary syndrome of menopause. Sounds complicated, but it isn't. So basically, all your vaginal atrophy or your increased risk of urinary tract infection, we now know that even local estrogen is highly effective here, with near complete reversal of atrophic changes in most women. So what are the benefits? What would you see? It's the improved lubrication, it's the reduced pain during sex, it's the normalization of your vaginal pH, and improved vaginal health in overall. And this is one of the strongest therapeutic indications with actually excellent safety data, especially for local preparations. Number 4, which is very exciting, about cognitive function and dementia. So the Endocrine Society stresses the timing hypothesis. If you start your hormone replacement therapy before age 60 or within 10 years of menopause, this seems to be associated with neutral or potentially favorable cognitive outcomes. But we're not certain if the hormone replacement therapy is started later, it actually may increase dementia risk. Number 5. How about your bones and the risk for osteoporotic fractures? We know estrogen is a potent anti-resorptive agent. It increases your bone mineral density at spine and also at the hips, reduces vertebral and non-vertebral fractures, hip fractures, and we know that hormone replacement therapy is actually appropriate for younger postmenopausal women who need, on the one hand, the symptom control and have also concurrent skeletal protection as well. Number 6, very interesting, type 2 diabetes. We know that in estrogen therapy improves the insulin sensitivity, reduces your abdominal fat mass, and lowers the incidence of new onset type 2 diabetes. And there is about 35% risk reduction if you're on estrogen alone. So what is the mechanism behind it? How does it happen? We know that estrogen actually improves hepatic glucose output and also improves how insulin acts in the periphery. Isn't that interesting? Number 7, I also mentioned about it previously, but it is very important for many of you, which is the recurrent urinary tract infections. Local vaginal estrogen significantly actually reduces the urinary tract infection occurrence by restoring the lactobacillus dominant vaginal microbiome and also improving the urethral epithelial integrity. An interesting thing is that this is one of the clearest and well-documented non-vasomotor benefits of hormone replacement therapy. Number 8 is about falls and sarcopenia. So what is the evidence here? We know that estrogen therapy will improve your muscle function, your better balance. So how does it happen? The estrogen actually acts on your neuromuscular and connective tissue. Number 9, which can be interesting for many of you, which is the skin, the collagen, the wrinkles, the elasticity. We know that estrogen deficiency actually accelerates collagen loss. The hormone replacement therapy, it's been shown that it increases dermal collagen content, improves elasticity and hydration, and slows wrinkle formation as well. This could be interesting for many of you. Number 10 is a very common symptom that most do not associate with menopause. It's your eye health, dry eye and ocular surface. Here's the thing, hormone replacement therapy might reduce your dry eye symptoms by stabilizing the tear film and also improving the gland function within your eye. The effects are actually modest, but they are relevant in symptomatic women. Number 11, finally, osteoarthritis. Here's the thing we also now know is that estrogen receptors are expressed in cartilage and synovium of your joints. And the studies confirm reduced osteoarthritis progression, less joint stiffness, better function in the knee and hand osteoarthritis. The biological plausibility is high, and the evidence is supportive. And here the 12 might be more surprising, and you probably never heard of it. The oral health and teeth. Estrogen is associated actually with improved periodontal stability, reduced tooth loss, lower gingival inflammation. And what is the mechanism behind it? It actually is a reduction in bone turnover and improvement in connective tissue integrity. So I think it's very hopeful news that FDA removed the black spot warning, and hopefully more patients, more women will be more open to consider the hormone replacement therapy in order to treat their symptoms. If you found this video helpful, or you know someone who could benefit from this video, follow for more and forward this video to them as well. See you next time.